What we recognize in California is Medi-Cal has been running pretty much the same way since its creation.
The shortcomings included very disconnected systems of care. For example, a person seeking care through their medical provider, it didn't mean that that medical provider connected with their behavioral health provider, nor did it mean that person received case management services addressing their complex needs.
CalAIM is a new and innovative approach from the California Department of Healthcare Services and the Newsom administration.
CalAIM is the largest overhaul of the Medi-Cal program in history. It is multi-year, it is ambitious, and it holds the promise of complete transformation of the healthcare system for Medi-Cal patients in the long term.
CenCal Health has an incredible opportunity in implementing CalAIM, which is California's advancing and innovating Medi-Cal. Through this sort of statewide initiative, we will be thinking about equity within the Medi-Cal program, access, expanding partnerships, and so multiple opportunities for our organization to expand its role and reach.
The goals of CalAIM are to identify and manage the comprehensive needs of Medi-Cal members, improve quality outcomes and reduce health disparities, and make Medi-Cal a more consistent and seamless system.
Well, I think what CalAIM is going to offer is the ability to connect services that aren't currently connected. So we're going to be able to communicate across elements, whether it's behavioral health or public health, drug and alcohol services.
The goal of CalAIM is to encourage health plans to look at our members from a whole person perspective. So that means the whole continuum of care will be delivered, from starting with prevention to treatment to addressing the social drivers that contribute to their health outcomes.
80% of an individual's health is related to the social determinants of health: what they eat, where they live, their access to health care, their access to mental health care. These social determinants of health are the real predominant influencers of an individual's health.
All of these factors really do affect outcomes because they affect access. Removing many of these by identifying them and recognizing that they are big factors in how people achieve and access healthcare is going to be just monumental.
And so addressing social determinants of health means really thinking about health more from a lens of wellness.
We get to think outside of the box now as we're delivering healthcare. And I'm really glad that we're finally moving in that direction.
CalAIM will help our most vulnerable community members, such as those experiencing significant health problems, experiencing homelessness, transitioning from incarceration back to the community, children with special complex medical needs such as cancer, epilepsy, and youth and children in foster care.
For successful implementation of CalAIM, CenCal Health needs to cultivate community partnerships.
These providers are anchored in our community and know how to address the clinical and non-clinical needs, such as coordinating care with medical, behavioral, social, oral, and community support services.
Historically, providers of homeless services, sobering center services have not been able to contract with CenCal Health because there has been no reimbursement mechanism through the Medi-Cal program. With CalAIM, there now is that opportunity, and we are thrilled to broaden our provider network to include these community-based organizations whom we know are serving our members on a daily basis.
We will be partnering up with non-traditional partners such as community-based organizations, community-based advocates, doing outreach, doing case management to specific populations.
Good Samaritan Shelter has really been built on collaborations, and so our partnership with CenCal with their CalAIM efforts is really a natural fit for us. It will allow us to be able to provide even more services than we were able to before for the clients that we serve that are also members of CenCal.
For our providers, it means access to new resources that were never before available to help their most vulnerable members.
because it will help us to sustain programs and even open new initiatives that we haven't been able to do before. To be able to provide everything from case management and homeless services through to housing navigation and housing services.
Providers have a revenue stream to support the holistic needs of their patients, to help them secure housing, to ensure that they and their families have access to consistent and good quality food, and to help raise their overall health within our community.
The sustainability of the funding for the support services is critical. For our clients, it's incredible.
One of the things to remember about Medi-Cal is it's a taxpayer-funded program. So the healthier we can help our members become, the reduction that we can see in those healthcare costs benefit them directly, but also benefit the taxpayers.
When we see equitable access for all members of our community, and when we see the social determinants of health really being considered as part of the broader healthcare picture, then we'll know that CalAIM has been successful in our community.
Anything that will help the most vulnerable populations in our communities will help us and help us achieve, because we are all occupying this space together.
We are all members of the healthcare system, and the more that we can help promote and ensure the health of everyone who is served throughout that system, the better off our communities will be.